Okay guys, let's say hello to the guest for today, Dr. Nur Hayati Marzuki, Medical Respiratory Institute from HKL. Thank you very much for joining us to talk about the topic of asthma. Yes. I think surveys have shown that a lot of Malaysians are underdiagnosed, undertreated, and for children, it's 1 out of 10 are suffering from this particular condition.
Right. Okay, the last survey that we did a few years back shows that not only children, even for adults, is about around 5 to 10% of our population is actually suffering from asthma. Rightly so, yes, we are underdiagnosing it, and also the symptoms has been underplayed, or they underestimate their symptoms, both on the physician's part and also especially on the patient's part. But in actual fact, asthma is something that you can control very well with medication. What happened initially, it is that asthma is a chronic inflammatory disease which involves the airway. What happened, there are allergens from either outside or also internal factors that can cause this inflammation. Yeah, then what happened, the airway will be constricted and will be actually causing a lot of airflow obstruction that cause a lot of symptoms of asthma. Okay, which we don't, sometimes we put it up as just a normal cough or just a bit here and there, feeling a bit of breathless. But these patients who are sometimes can be, their exercise can be limited, their daily activities can be limited, can live a normal life with a proper medication and diagnosis. That is the one thing that we have to stress here. We haven't found any cure for asthma, but we have medications to actually control, manage this asthma. But unfortunately, most of these patients, one is either because of the cause, but as you know, in government we are still giving all this medication free. They like to use a reliever medication, which can be salbutamol or Ventolin, because of the quick relief. But to suppress this inflammation, we need another medication, which is inhaled steroids. The steroids is safe because it just goes to your lung.
The inhaler steroids.
Yeah, the inhaler steroids. So what it does is it suppresses the inflammation, and that controls your asthma, and this has to be taken every day without fail. And once your asthma is controlled, then you can absolutely live a normal life, and that is the aim of treatment, to get a proper control of the asthma.
Right. Might surprise you to know, many professional footballers are also asthmatic, and they have it under control pretty well.
I know one.
You know one. All right, before we come back to find out who, let's take a quick look at this Vox Pop and what the Malaysian public have to say about asthma.
Hi, my name is Chris. I'm from KL. I have a question. What kind of test did I need to monitor my asthma?
That's just one Malaysian and what he had to say.
I was asking. Okay, actually I was asking doctor because I had a real life experience. My son was diagnosed with asthma, and literally for me, before I started reading it up, I was totally devastated. I'm like, oh my God, his life is ending. But then I know that Beckham was suffering from asthma. So maybe you can share with us your comments on, how to, especially for children, to lead an optimal life while managing asthma.
Right, okay, there are a lot of factors, a lot of triggers for asthma. One of it is pollution, all this haze, and also smoking. The cigarette smoke is definitely one of the pollution that can cause asthma. Besides that is the environmental. Okay, all this dust house mites, your curtains, your carpets, if you have cats and dogs. So you have to, if they're allergic to all these things, then you have to get rid of it.
As parents, you need to take
you have to take initiative to look for what are the things that cause them the allergies. And number two, you should not be afraid that to put them on medication. As I said, steroid just goes to the lung. There is very, very minimal side effects systemically. So it's okay. And the problem with children with asthma, the growth will be stunted. Alright, and they have a lot of problem. If they get the asthmatic attacks, then they will be missing school, so that will be worse off. So to put them under control, you have to put them on the inhaled steroid. That
on a daily basis.
On the daily basis, and you should not miss that.
Even though they're not feeling breathless.
Yes, even though they are not feeling breathless,
I think that is one part that a lot of people.
because studies have shown that this inflammation, once you stop the steroids, it will just be there for about 12 months, even in those patients who are under control.
Right.
But don't be despair.
Right.
My family, all 4 of us, I have 2 kids, my husband and I, we are all sufferers of asthma. We are all asthmatics, but my 2 children are doing fine. My husband is doing fine. So you know, you have, because the thing is, once both parents are asthmatic, 80% of their children will be asthmatic. Okay, and it also comes in associated with hay fever, allergic rhinitis, and also eczema. Some people have all 3 of them. So you know, the thing is to get help and get diagnosed and get the treatment. That's the main thing for asthma.
Now, it's one thing to be born with asthma, but can you get it along the way, though?
Yes, you do. You can. You know, especially if you do have a very strong family history of asthma, like still your siblings have asthma, so you might along the way. We do diagnose patients at 50-year-old, 40-year-old with asthma. Yeah, but people always think that those people who are smokers are suffering from asthma at the later age, but that is a totally different disease, which is called COPD. But asthma, you have all these allergies and everything.
Okay.
COPD sounds like a self-sought disease, something you inflict on yourself.
Yes. Okay, there's another workshop coming up. Then we'll ask the good doctor another question.
In my life that I can change to reduce my risk of an asthma attack.
Kinds of things can he do in his daily life to reduce his own risk of asthma?
That means this is a person who has been diagnosed with asthma since a young age.
Right. For one, you have, again, as I said, you have to look for the allergies. Okay. If say you are allergic to durian, don't eat durian. You know, if you have to be. I mean, if you are allergic to dust, you have to be sure that you take care. You know, your carpets you have to throw away your carpets. Your curtains have to always be clean. Your sheets has to be changed in order to reduce the dust mites and all. If say you are like, some people are allergic to cold, you know, the change of weather and all. So you have to get yourself well, you know, put on a heavy clothing or anything like that. But at the same thing, still the main thing is still the medications. Once the the steroids bought, the inflammation is reduced, if not back to normal life, at least you can be halfway there. But there are medication. If the steroids doesn't help, we can add on other medication as adjunctive, but the mainstay still is steroids, inhaler.
Can you share with the viewers what are the taboos or old wives' tales that people do talk about people who have asthma? You know, as parents, people advise us do not give the child who has asthma a bath very late at night or a cold bath and so forth. So can you kindly share with the viewers what are the taboos that been going on?
Right, there are a lot of taboos with asthma. Is because people do not understand the disease, and people do not understand what causes it. Okay, the reason that they have asthma when they take cold bath is because of the cold, not because of the bath per se. If say you cannot take cold bath, you can
take a warm bath.
Take a warm bath. And if you are under control, you're on medication, inshallah everything will be fine. But having said that, there are 10% in any clinic that this patient are difficult to control asthma, but yet there are other medication that we can add on, and there are specialized treatment which we can do in order to suppress and control this asthma. The main aim is still to control the asthma, and you have to comply to the medication. That is the main thing that you have to do. Compliance is the key. You know, if you do not comply to the medication, your asthma will not be controlled, and it will be difficult for you to, you know, get on with your life and everything, you know. And the thing is, sometimes all the school children, they see their friends, they can't do sports, they can't do anything, they get breathless, and some of these children are so afraid that their friends might be calling them names because they are just using inhalers. But you know, it's better to use the inhaler than getting sick.
Correct.
You know?
So the whole I cannot do sports thing is a self-inflicted thing. All you have to do is really take your medication.
Take medication, and before sports, just take 2 relievers puff, then
Okay.
Right, I mean, we
Okay.
quoted David Beckham as being a smoker,
Yeah.
so you know, he's
Is
the
there
guy with the
any-
bending goals.
Oh yeah, I've seen that videos
Yeah.
by the beach. Is there any exercise that can help to for asthma sufferers? You know, like swimming and so forth.
you can do, because what it does is strengthens the muscle and all. But again, that won't get you off with asthma. You see, still the mainstay is still treatment. Yeah, and don't worry about the steroids. People are so afraid when you say steroids. They say, "Oh, please, I don't want them to be on steroids." But this steroid just goes to your lung. It doesn't go into your body. Systemically.
Right.
See, so the side effects, because there are a lot of side effects of steroids, like can get diabetic, osteoporosis and all. But when it goes to the lung, it just reduces the inflammation there, and it is controlled over there.
Medication for asthma is readily available at your nearest government hospital. You can consult any pediatrician, of course, if you have a situation with your child. Thank you so much, doctor, for being
Thank
on
you very
board with
much.
us.
Thank you.
It's a pleasure having you.
Yeah.